Welcome to Next Phase Human, where medicine meets performance and science meets longevity. I'm your host, Dr. Rasham Sandhu, and with me today is Dr. Rasha Quran for a second part of our conversation that we started about infectious disease, the life that we live with microbes, microbiome. So if you want to hear more about the microbiome and COVID-19 and antibiotics in kids, do listen to the previous episode. But today we carry on our conversation starting from valley fever. And just for people who are joining us, Dr. Quran is an infectious disease specialist at Kern Medical Center and UCLA and is the director of Infectious Disease Fellowship. Thank you, Dr. Quran, for joining.
Thank you. Thank you for inviting me.
So, what exactly is valley fever? There's a lot of talk. These spores, they lay in the dust. They are living amongst us. And what is it? How does it impact us? How dangerous it is?
Valley fever is an infection caused by a fungus that lives in the soil of the central San Joaquin Valley. Think of it as if you've seen the compost heap and you see mold growing in the compost heap, molds grow in the dirt and they compost and decompose organic matter. Now, what's interesting about this fungus is, along with other fungi we call the dimorphic fungi, is that it acquired the ability to also grow or infect animals in addition to plant matter. And so it lives in the soil. And when it gets hot and dry and windy, the wind picks it up and we can breathe it, and it can cause an infection that manifests as the flu or pneumonia. It's usually a pneumonia or no symptoms. So out of 100 people who get the infection, 60% will have no symptoms and 40% will develop the symptoms that look like the flu or pneumonia. And out of those, the majority will be fine. Some of them will require treatment. Some of them will not require treatment. But about 1 to 5% will end up with severe complications.
Who should worry?
Everybody who breathes in the Central Valley or the areas where this fungus exists.
Is it only in Central Valley?
In California, we have it in the Central Valley, and sometimes it spills over if there's dust storm or an earthquake, for example. It spilled over to the north areas in Los Angeles. But really in the Central Valley and then Arizona and other states.
So it is there in Arizona, Texas, Nevada. You see cases there also?
Yes. Arizona and California are, they used to be similar in numbers. I think we exceeded them last year, but those are the two hot spots.
So mostly it's a disease of desert Southwest.
Yes, arid areas, arid climates where it rains and then it gets dry. And then Central and South America, some countries have it too.
And is there like a particular kind of person who's more likely to get in trouble with this?
So there are two questions. Who's more likely to get infected, and then who's more likely to get severe disease once infected? And who's more likely to get infected it depends on the exposure, who works outside and who is exposed to the outside more. But who's more likely to go into a severe stage of the disease? That is an interesting, an interesting thing to study, because some people are susceptible for severe disease because their immune system is weak and they're taking steroids or chemotherapy or transplantation. But others, it's just genetic predisposition, and really not all of those genetic differences are known to this day. They run differently in different ancestry. So based on the ethnic background or race, actually. So we're actively now studying those differences, and we're sending our patients' blood to UCLA for genetic analysis and DNA sequencing and all that to figure out what are those genetic differences. If they were all genetic, some might be epigenetic, but we're working on figuring that out.
So as a parent, kids play outside all the time. Should parents worry about it, and what can they do?
If it's dusty, if the wind is dusty or windy outside, I would bring the kids inside.
Okay, so that's the single most
Yes. I wouldn't
effective
have
intervention.
Yeah, the soil that's higher in risk is the soil that hasn't been disturbed for a long time. It's not the soil that's been tilled every year, like the agricultural areas. That soil is usually not containing the fungus, but the wind can bring it from 70 miles away. So yeah, if it's windy or dusty, or playing or working in areas with the soil and getting it disturbed, that puts someone at high risk.
And is it becoming more common compared to before?
It's becoming more common.
Why
In
is that?
part because people are moving here. The population is growing and people are moving into the area. It's more affordable than other parts of California, but also because of other factors such as climate changes um, and increased temperatures, etc., and more advancement of urban structures into new areas all the time. It's more common.
So, as a patient, or for any healthcare provider who's listening, when should they think about a patient having valley fever? When should they test?
So anyone who lives in areas where valley fever is common, and in California, that's the Central Valley. Anyone who has pneumonia, and by pneumonia, I mean the symptoms of fever, cough, chest pain, headache, shortness of breath, plus minus rash, should think valley fever. And whether it's if it's a provider or a patient, community-acquired pneumonia in this area, a third of it approximately is valley fever. And, and so the question becomes, do you test them the first time or the second time or the third time if they do not respond to antibiotics? And my answer is I would check them the first time. Now, if someone does get a prescription for antibiotics and doesn't get better, the possibility is really high that this is valley fever. So there's really no point in giving another prescription of antibiotics without testing for valley fever, at least to someone who didn't respond to antibiotics.
And what does that test involve?
And that's tricky. So it's a blood test that can be negative for the first 8 weeks.
Oh, wow.
From symptom onset. So it's confusing. And that's why everybody should really be familiar with valley fever when it comes to healthcare providers. So you want to test with the blood test. That blood test doesn't come back immediately. It takes a week or two to come back. But even if it's negative, that doesn't mean it's not valley fever. And if the patient's really sick, there's no problem in giving the patient the treatment for valley fever until the test is repeated and we know it's positive or negative.
So if someone is not getting better, 2 tests would be the minimum that you would do 8 weeks apart? Is that?
We repeat it weekly until 8 weeks have passed.
Okay. So every week you repeat it?
Yes, until 8 weeks have passed from the onset of symptoms.
So anyone who has pneumonia in these areas where valley fever is endemic, whether that entire Southwest, let's just think U.S. Desert Southwest, should be tested, or at least it should be in the back of the mind to look for valley fever in these people. Yes,
I would test them the first time and repeat if it's still a possibility, like patient's not better or there's another possibility that's been ruled in, I would repeat the testing.
What are the big misconceptions that you see, like that you hear in your office about valley fever? You talk to someone about it, and in terms of treatment or prevention, is there anything that we should tell people or healthcare providers about this?
So one thing is that it's not contagious. People cannot give it from one to other people. Another one for the providers is titrating the medication. I see this all the time. We don't titrate antibiotics like pain medicines or corticosteroids. I see the practitioners in the community titrating the medications up and down, and I'm not sure where that came from, but we don't titrate antibiotics. And then like people with valley fever, meningitis, stopping the treatment because they feel better or to see, and that can often lead to devastating consequences that are irreversible. People with diabetes are the ones who are high risk for their lung problem not getting better until they control their blood sugar. So they can be on medications for a long time, and as long as their blood sugars are not controlled, the lung problems
Your immune system is not
may not
helping
get better,
you.
despite the medications.
How long is the treatment?
Until the patient gets better. There's
So it
really
could be months.
Yeah, we're counting weeks and months with valley fever as opposed to days with bacterial
Antibiotics.
infections. So people who do require treatment on average require 3 to 6 months of treatment. We follow the blood test that is done at the public health department closely, because that test is really helpful and accurate. So we treat until the titers are negative, but that's different from one provider to the other. We happen to be more strict with it, and because we want the lesser likelihood of relapse. Valley fever can relapse after we stop the treatment; it can come back. And there's really no way to guarantee that it's gone from the body for the rest of someone's life. And unfortunately, there are no medications that kill it in a guaranteed way. The medicine weakens it enough to allow the immune system to control it, but not really guarantee cure from it. So there's always a possibility that it can come back for the rest of someone's life.
So anyone who has had valley fever in future illnesses should be mindful that it can come back.
Yes. And that likelihood of relapse is the highest in the first 2 years after the discontinuation of treatment of medications. So we watch everyone for 2 years after we stop the medicine.
Got it. So are fungal infections becoming more of a concern than bacterial infections now?
So valley fever aside, that's a geographic concern. Other fungal infections go with immunity. So the immune system. People with weakened immune systems are more susceptible to fungal infections. So such as yeast infections with diabetes, with corticosteroids or cortisone treatments, people who are on medications that lower their immune system are susceptible for fungal infections.
And tick-borne illnesses. So illnesses like Lyme disease or whatnot, not common in where we live. But do you see them increasing in general?
Insects do change and migrate and change with the climate and with many different factors. So they are changing in location and increasing.
So we talked about a lot of infections, and as someone who is otherwise generally healthy, what can I do to minimize my risk? One, in general, to protect myself of day-to-day infections, and second, like things like valley fever, if you are living or traveling in the area.
So 2 things. There are the communicable diseases, and then there are the infections that we get from within our body. Communicable diseases, you don't want to be exposed to them. So as we said, the Staph aureus infection, going to the gym, you want to be mindful, disinfect the equipment before sitting on it, etc. There are infections you get by traveling to certain areas or being exposed to others, like tuberculosis. For tuberculosis, you want to if someone's coughing or appears ill, you don't want to be, you want them to get checked out or tested and treated. But also traveling to endemic areas for tuberculosis, you want to be cautious. If you have been to other areas and you got tested and you have the infection with tuberculosis, which is what we call the positive skin test or the positive blood test, it is a good idea to be treated for the infection so it doesn't turn into disease later on when we are older or weaker. So there's the exposure part for brucellosis, for example, drinking raw milk. You can get infections that way, even if you're healthy. The sexually transmitted diseases, you want to, be mindful of the safe precautions. Injecting drugs will transfer infections. So behaviors that put someone at a higher risk for acquiring infection, we need to know what they are. Now, the other types of infections, such as urinary tract infection and pneumonia, those depend on how strong your immune system is. And I can tell you probably the most common problem that weakens the immune system is high blood sugar. And I tend to say high blood sugar, not diabetes, because people who do have diabetes, if they control their blood sugar, they act like someone who doesn't have diabetes. So it's the high blood sugar or diabetes, uncontrolled diabetes, that is an immunocompromised state. So preventing that, diabetes is preventable. A lot of the time, I'm not saying everybody.
Not all.
Yes, not all of them for sure. But a lot of the times you can control it with, and live a healthy life by choosing what to eat and what not to eat. So eating the right things, being active, and avoiding risky practices, generally speaking.
Does exercise help?
Yes, exercise affects the immune system in a positive way. And so it just makes us healthier.
So in twofolds at least, the blood sugar control with exercise and exercise itself will make your immune cells work better.
Yes. Yeah.
Any particular kind of exercise or any kind of activity should do that?
Aerobic exercise, what do you call it? Cardio. That has been associated with better immune system. But I think generally being active is always a good idea.
Does sleep have impact on infections?
Yes. There's so much that happens when we're asleep, where that regenerates our health. And I do not claim to be an expert on that, but I just know that a lot of the changes that occur when we sleep are necessary to reset our health.
Yeah, so there is data on even like increased risk of cancer with poor sleep. So our immune cells just don't work well when we don't sleep.
Absolutely, yeah. And I believe it, because how do you feel if you don't sleep for a couple of days?
Exactly. The recovery is as important. And I think as a country, we are under-recovered.
Even there's even studies on the position of the head and the lymphatic drainage of the brain fluids, how it changes. So we really need to sleep and actually recline like that.
In a reclining position.
Yes.
We were meant to lay down and sleep.
Yes, it makes a difference.
Yeah, absolutely. Vitamin D, any evidence of that helping with infections?
I'm not aware of it if it's there, so I don't know.
Is there, we talked a little bit on the last episode about hormones and infections. Can you touch up a little bit on that?
Yeah.
How that works? And
the one that affects my patients the most is urinary tract infections in ladies who are postmenopausal. This is one of the most beneficial things I have learned about, where topical treatment with the hormone can prevent urinary tract infections. This is way underutilized. People don't know much about it yet. It's now becoming more common that patients are receiving this, but it's really, really helpful in preventing urinary tract infections.
Do you usually recommend estrogen patches or gels topically in the vaginal area for that?
The studies did not show the same benefit when taking systemically. So this benefit is only shown with topical treatment, local treatment. And that could be because of the levels and the amount of hormone. But for now, it's topical. So even if the lady is taking systemic estrogen, she still might need to take the topical one.
Got it. Are there any supplements that you routinely recommend or tell people to avoid?
Other than just eating, no supplements, I do not. Avoid, I would say, I will avoid supplements unless I know that they are good for me. I'm not a supplement person, so I focus on eating healthy food.
Eating healthy, living good,
yes.
Exercise.
Yes, and I'm not saying there are no good supplements out there, but I just have not dived into them or found something that I want to take.
So we'll go through like a few quick myth or fact, true or false, and just want to get your take on these. So do antibiotics help viral infections?
No.
So that's a hard no.
That's a hard no. Antibacterials do not help viral infections.
So that's another one you hear a lot. You should always finish every antibiotic prescription exactly as prescribed. Is there truth to it?
There's truth to it, yes. Although, when it's prescribed as a patient, yes, take the prescribed antibiotic as taken, because what other guidance will you take?
A lot of times I hear people, okay, I got better and I stopped it. Is there downside to it?
It's probably not really wrong, because we're now inching towards using less and less and less. So we're studying shorter courses, and the shorter courses that we can get away with that work, we will take in the medical community. So, I think once patients feel better, it's probably not very harmful to stop the antibiotic. But at this time, what other guidance can I give the patient? And so I would take it until...
So if you stop it, you're kind of in uncharted territory. We just don't know enough yet.
Yeah. Because again, without the medical practitioner knowing what they're looking at, I would say take it all.
Hand sanitizer or soap and water?
I would go for soap and water.
Why is that?
If it's available. It feels cleaner, right? So it's cleaner. No, so soap and water will remove the residue of solid material on the hands, as well as to remove the germs. The sanitizer will kill the germs, not 100% of them, but for the most part, yes, it will. But all the precipitated residues, solid residues, will continue to accumulate. So, there's a number of times you can use the sanitizer before you have to wash again. If they're both available, I like to go for the hand washing, but the sanitizer is good.
This is something that comes up. Raw milk is healthier than pasteurized milk, true or false?
Not in my book. You can get brucella and you can die from raw milk, and we see that. I see patients.
What does brucella do? What does it look like?
It's an infection. It's a bacteria that lives or infects cattle, and it can go out in their milk if they're infected. And there's really, sometimes it's hard to tell if they're infected or not. And so it's inevitable that sometimes it gets in the milk. And if people drink it, they can get brucellosis. Brucellosis is an infection that manifests as fever of unknown origin, or meningitis, or endocarditis, infection of the heart.
So it's a pretty serious infection.
Yes.
Can it be treated?
It can be treated if it's diagnosed early and thought about, because it doesn't grow in the cultures that we do that easily. So it can be missed also.
You have to be looking for it.
Yeah, it can be missed easily.
Everyone should take probiotics, true or false?
To me, no. If someone's healthy, I don't see a reason to take probiotics if there's no reason to.
Does sugar impact your immune system?
Yes.
Big
Especially fructose, yes.
Zinc, does it prevent colds?
Yeah, there's data for that.
So for someone who is coming down with a cold, is there a reason to use it?
There's data that it can prevent colds, yes. And it came out in a topical form once, and then they took it off the market because of loss of smell side effects. But there's now the lozenges, and there's data behind them. So
we talked about sugar impacting immune system. So does keto diet help with infections?
This is interesting. I was looking into UTI treatment once, and I don't know why I went to papers that were published before antibiotics were discovered. And so I found a bunch of them that talk about treating UTIs with ketogenic diet. And so apparently that was a thing, and that was the treatment.
And it worked.
And it worked. And the way they discovered that was some microbiologist noted in the lab that the urine sample from patients who are on the ketogenic diet to treat epilepsy, which was the treatment for epilepsy at that time, doesn't overgrow with molds and bacteria in the lab when it's left on the shelf for too long. And all the other ones do. That's just natural. They start growing stuff. And so they started using the ketogenic diet to treat UTIs at that time. This ended when antibiotics became available and more convenient. But that really goes back to how what we eat and what we do affects our immune system and affects our susceptibility to infections.
So interesting. Yeah, I knew about the ketogenic diet to treat epilepsy back in the day.
Mm-hmm.
but I didn't know about the
Yeah.
UTI treatment with
that was a
ketogenic diet.
nice surprise. It
Yeah.
was a bunch of papers, not just one or two. So it was apparently working for them.
Is natural immunity always better than vaccine-induced?
I think it's powerful immunity usually, but again, you're gambling with the infection that you're going to get and the possibility that the infection might harm more than the benefit.
But if you have it,
But if you survive, it's usually more
robust.
Robust, yes.
Should fever always be treated immediately?
Not all the time. So if it's a flu, if it's a cold, if it's a viral infection, and by treated, I mean, it depends on what you mean by treated.
Like antibiotics and stuff.
Yeah, if I have a cold or a flu of the flu and I get a little fever, I would not take medications for it. And as a matter of fact, even medications to lower my temperature, my body temperature, there's benefit from having your body temperature go up a little bit. So a low-grade fever or a moderate fever helps the immune system fight. If it's really high, obviously there are some risks. So that's when people would want to lower it. But not every fever needs to be treated.
So if every family were to adopt certain habits to live a healthier life from infectious disease standpoint, what would be your recommendation on that?
So my first recommendation is, if you can, cook food at home. That's been proven by studies to lead to less disease. And then be active and exercise together. And the third one is do activities together and be a healthy family with a good relationship. You can use the cooking itself as a communal activity where you can do it together. So people who do like pray or dance together, they're known to have healthier lives. And so having a close relationship and doing things together is also healthy.
And so we talked a lot about the doom and gloom scenarios on the antibiotic resistance and whatnot, about the valley fever. What gives you optimism about people with infections? What does the future hold?
What gives me optimism is I'm naturally an optimistic person, but with infections, we're actually sitting at a milestone in the history of infectious diseases. If you think of the era prior to antibiotics, and then there's the era of antibiotics, as started with penicillin until today, we are at the onset of the era of treating infections with immune modulation, which is the next phase. And I'm privileged to work with the people who are doing this. There's a Dr. Manish Butte, who's a colleague from UCLA, who published a paper a couple of years ago where they treated a young boy with valley fever, disseminated to bone and everywhere, with immune modulation. Meaning,
so what does that mean?
They gave the child cytokines, which are compounds that our body makes to steer the immune system in one way or the other. The immune system has many arms and they go in many directions, and the cell can be activated to go this way or that way. And so there are cytokines that would make the white cell fight fungus versus get activated to fight allergies. And so he looked at which ones do what, and he gave that boy two of the ones that steer the white cells to treat fungus, and the boy got better.
Oh, impressive.
And yeah, I think I'm very excited to see the fruits of that observation, and even further start looking into immune modulation to treat infection. That would be great, because we wouldn't have the side effects
of antibiotics. So there is an era that's coming in which we may need less antibiotics.
I look forward to it, yeah. I would hope that I could be part of this transition, but it's happening right now.
Wow, that is great. So on that positive note, we'll close today. Thank you so much for joining us. This has been a lot of great information. Thank you.
It's my pleasure. Thank you, Dr. Sandhu, for inviting me.
Thank
Thanks.
you.